Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, what I want to talk about today is why is Spinal Kinetics so important in the injury market today? As the CEO of Spinal Kinetics, I'm going to talk a little bit about Spinal Kinetics because Spinal Kinetics was a part of a project that I did when I first started out in doing spinal ligament injury testings. One of the things I said is there has to be standardized ligament injury workups in the spinal injury market. And it doesn't matter whether a chiropractor is doing it, a physical therapist is doing it, a medical doctor is doing it. There has to be a standardized medical procedure, standardized testing procedures to work these things up. It should be like if you have a spinal injury, it should be like if you have a cavity going into a dentist, right? Any dentist in America, if you walked in a cavity, pretty much does the same things. Anybody that walks in with a spinal injury, the same things, standardized procedures should be done. First of all, you only have 3 injuries. What do you have? You have bone and connective tissue. So did you break the bone? Did you fracture the spine in any way? No, I did not. Okay, if you injured the spine, then you have to injure the soft tissue. And the only soft tissue that's there is the ligament tissue, essentially. So you have 220 specialized ligaments. You have 23 of which are discs. So did you herniate the disc or did you damage the support ligaments around the disc? Now, if you damage the support ligaments around the disc, you are going to have excessive motion. If you have excessive motion, you're going to have facet problems. You're going to have a facet injury, right? There's so many different things that you can have. So many of the symptoms of what people have really come from spinal instability. Now, why is Spinal Kinetics important? Well, because it's a medical company that's been in the market now for 13 years as a national company. It's been in the market for 13 years. We've been doing this for a long time. And what we provide independent providers, whether you're a medical doctor, you're a doctor of chiropractic, you're a doctor of osteopathy, and soon coming in, doctor of PT, no matter what you are, if you want an accurate excessive motion test, we have medical services that do that. We're the only company in the country that has 2 medical radiologists that perform the service on every single study. So what happens is the studies come up to us, right? We get them up from the provider. The providers send them into us digitally. Either they send them in digitally through their own x-ray machines or digitally through an uploader that can easily be set up for your clinic. They come in with the order, right? They're set up by a rad tech and then they're pushed up to a radiologist. A radiologist uses that technology in order to have the points placed, and then those points are verified and validated and changed if need be by that radiologist. It then is sent to a second radiologist to be verified. So the accuracy of the points are then verified. So there's 2 radiologists on every study. There's no company in the country that does that. But today, when I say it's really an important company, it's important because it's held the position that these ligament injuries are significant. Right now, if you take an excessive motion test can help any doctor determine the severity and location of a spinal ligament injury, to grade it, to determine how much excessive motion there is, to determine how much spinal instability that there is, to determine if there's a significant amount of spinal instability that would trigger surgical guidelines for spinal fusion surgeries or trigger athletic return to play parameters to keep athletes that are in contact sports out of their contact sport until the injury actually heals. There's excessive motion testing that actually identifies whether a patient has a higher probability for a disc herniation or not. They also clinically correlate to treatment guidelines such as the Croft treatment guidelines or such as chiropractic treatment guidelines found in the ICA, International Chiropractic Association best practices, and a number of other guidelines. So what they do is they allow the doctor to be guideline driven. They allow the doctor to be highly objective. In my private practice, I always wanted to have these studies done by an independent group because the results of the studies are so significant that I wanted them to be unbiased. I wanted somebody to say, okay, I didn't place these points. I didn't put these points in some software. I didn't do the study. I didn't want to appear that way. I wanted it to, now, can you do that? Yes, you can. There are softwares that allow you to do that. Some are better than others. But I always wanted it to be done independent, unbiased, by a board certified medical radiologist or by another radiologist, if possible. If possible. If it wasn't possible, then yeah, I got to find a way around that. But that's what makes Spinal Kinetics so unique, is we have been here for 13 years. I'm very proud of being the CEO of that company. We've been here for 13 years, and we are helping to standardize spinal ligament injury workups. We're helping to help doctors get more accurate diagnostics, get a more accurate picture of exactly what the patient has so they can do a hell of a lot better job in the treatment of these patients so that they can get better results with the patients. Everything we do in our company and everything I do in the companies that I have has everything to do with end results for the patient. It has to do with getting better patient results. When I look at the statistics of spinal ligament injuries, 55% or more of the people, when you look at research, are not going to fully recover from these injuries. I have always said and will continue to say that is not a patient problem. That is a doctor's problem. It's not a patient problem. Patients, I guess you could say the patient responsibilities, you need to find people who are good at getting treatment results. So I guess there is some patient responsibility if we want to look at it that way, but the responsibility lies in the doctors to understand the condition that they're treating, especially when they're treating spinal injuries, and to get much better patient outcomes, better patient results. That's everything that we're about. Better diagnostics for better patient results. So what is it that makes us unique, or why are we so important? Because we're in there. We've been for 13 years, not for 2 years, not for 24 months, not for 3 years, for the last 13 years, we have been a national company that has actually delivered services all across the country. We have the most experience with delivering these services of anyone in the country. And so that's what we offer the market. And it's not an easy business, right? It's not easy to do what we've done. We continue to use cutting edge technology, and we continue to advance technology so we can get better and more accurate procedures done by our board certified medical radiologists. Remember, all we're doing in the market is we're measuring things. We're accurately measuring things. And you, the doctor, then take those measurements and you go, what is the consensus about them? And you clinically correlate it to what you're finding with your patients. I believe that excessive motion testing, that the information that you get is the most important testing you can have with an injury patient. One, because there's a lot more accessory or support ligaments than there are disc ligaments. There's a lot more support ligaments. Remember, the support ligaments are probably the most important ligaments because they are the ones that keep in alignment both the bones and the disc. That's their job, right? So if disc misaligns, these ligaments generally have to be damaged in some way. And how you pick it up. If a person has a disc herniation, the first question anybody should be asking, if I had a disc herniation in my back right now, I'd want to know, what are the support ligaments doing? How much instability do I have at the level, above the level, or below the level? Because that's going to really determine how injured I am. If I was a work comp person that wanted to reduce down the significant costs of back injuries in the work comp arena, I would make sure that the patient had that the employee had an excessive motion test and a doctor that understood what to do with it. Not all doctors in the market are the same. There's a big difference. That's why we have what's called a bell curve. You have average. And another term for average is mediocre. I know, at one point in my career, I felt like I was a very average or mediocre provider because I was average, right? Didn't mean that I wasn't successful, didn't mean that I didn't make money, but I knew myself I was average. So if you're an employer You want to work with doctors that actually know how to diagnose, that know there's a hell of a lot more to a spine injury than a disc herniation, and know that spinal instability is probably the worst condition that your employee can have, especially if they're working with doctors that don't understand it, because their chances of getting a full recovery or getting a good recovery are significantly less. So we provide those doctors. We provide doctors, no matter where you want to go in the market, we provide doctors with accurate excessive motion testing on injury patients. And that's what we provide the market. I'm very proud of that. I'm very proud of the work. It's required a lot of work. We have a great team at Spinal Kinetics, and I'm very proud of my group. This is not an easy business to deliver, and we've been delivering it successfully now for 13 years. And when I say that, looking back, I go, wow, I've been doing this for 13 years with Spinal Kinetics. It's gone by pretty quick, but I believe that we have been the pioneering company in this particular area. We're solid, we're stable, we always have been, and that's what I'm very proud of in Spinal Kinetics. Look, if you're a doctor right now and you want more information about Spinal Kinetics, it's easy. Just go to thespinalkinetics.com, look us up, and you can call in and find out more about us or set up an account with us. But I just wanted to say that one of the things that the last thing I'm going to say is I do a lot of attorney education programs, a lot of attorney training programs. And trust me, doctors, if I ask an attorney, would you rather have board-certified medical radiologists doing the excessive motion testing, or would you rather have the treating provider themselves do it? If there's an option to have the board-certified medical radiologist do it, they're going to say board-certified medical radiologist. Now, if you don't have that as an option, then you're fine. You just have to be really solid and really good and confident with what you're doing. And you can do that. So anyway, again, if you want to find out more information or you want to call Spinal Kinetics, it's 877-508-9729. Doctors, on my podcast, what I do is just a short riff on a particular topic. I just wanted to throw this topic of Spinal Kinetics in today. I appreciate your time, your attention. I appreciate what you do, and I'll see you on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.